Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about breast density. And specifically, what you get in potentially your mammogram report that says you have dense breasts. What I want to do is try to explain what this is and try to allay some of the fears. So there are some new warnings that you may see in your mammogram that says that you have dense breasts and that the accuracy of the mammogram is diminished, and also that there is a potential smaller, higher risk of breast cancer. First I want to say is that breast density is very common, dense breasts. The density of the breast is dependent upon how much of the fibrous tissue there is, how much of the glandular tissue that would make breast milk if you were breastfeeding, and how much fatty tissue there is. And the less fat, the more the other tissue, the denser the breasts are. But it's variously quoted that between 50 and 70% of women have dense breasts. So it's not an abnormality, it is at least the average, or perhaps even, depending on who you quote, the majority. So that being said, if you get that report, it's not a reason to be alarmed. You do need to follow the guidelines, which change on a frequent enough basis that it's worthy of a discussion with your physician. I do have a separate video on mammography. You can look at that for more details. So I would prefer it instead of the quote that gets on your mammogram. It seems like a very pessimistic quote to tell you that the mammogram is less reliable. What I would prefer would be a more optimistic quote that says, if you don't have dense breasts, to say, guess what? Your density is lower, and that improves the accuracy of the mammogram and reduces your risk of breast cancer. But I don't set the rules, okay? Be sure to get your mammograms and as appropriate, watch that video. And if you are at higher risk, then you may be eligible for the breast and ovarian cancer gene test, the BRCA test. And I have some videos on that as well, okay? So what's important is the category of your mammogram. There's category 1, 2, 3, 4, 5. If you have a category 1, that's very reassuring. Category 2 is also reassuring, but it means there's an area they're looking at. Category 3 means there's an area they're looking at that they might be concerned of, and generally speaking, you get a more frequent follow-up. Category 4 means they are concerned enough to usually recommend a biopsy because there might be a breast cancer. And category 5 says they're highly suspicious that there is a breast cancer. Okay, so if you get a mammogram report that says you have dense breasts, or if you feel on yourself that your breasts feel little lumps and throughout, and they have throughout your life, that doesn't mean that you're abnormal or there's something of concern, but it is worthy of a discussion with your physician. So now that we're on this topic, what are some things that you could do to reduce your risk of breast cancer? Well, there are some things. One is to eat right and exercise and stay at a healthy weight. There is a correlation between being overweight and significantly overweight and breast cancer. Excess estrogen could potentially increase the risk, and if you're overweight, fat cells make estrogen, so that might be a potential mechanism for how it increases the risk of breast cancer. If you have children and you're considering breastfeeding, we encourage it. 4 months of breastfeeding can reduce the risk of breast cancer by as much as 50%, and even more so if you breastfeed more, it also reduces the risk of ovarian cancer. So that's of great value as well. There are changes in the recommendations of diet, but generally low-fat diet. Mediterranean diet is popular now, with some antioxidants could potentially reduce your risk, like a few nuts, walnuts, almonds, pomegranate, some coffee, believe it or not. If you are at high risk and you're in menopause, you might be a candidate for some breast cancer risk reducing medications like raloxifene or tamoxifen. Those are certainly medicines that you would discuss with your physician, but you might be a candidate, again, if you're in menopause. So those are some of the general recommendations that can help you. I hope you found these useful. And one more thing, stay away from smoking. For all cancers, yes, it increases the risk of breast cancer, but and vaping's on that list too. So I hope you have found these videos useful. Please leave your comments. Thank you.